The Food and Drug Administration is putting strict limits on who can get the Johnson & Johnson COVID-19 vaccine over a rare but serious risk of blood clots. Now it will only be given to adults who cannot get a different vaccine or specifically request it. Now this follows months of recommendations that Americans opt for the Pfizer or Moderna shots instead. Well, joining us now is Dr. Chirag Patel, Assistant Chief Medical Officer at UF Health, who's joining us live via Zoom. And good morning, doctor. First off, thank you for being here this morning.
Good morning and happy Mother's Day to all the moms out there.
Yes, happy Mother's Day to all of those moms. I want to jump right into this. So I know the CDC identified 28 cases of life-threatening blood clots out of more than 8.7 million people who got the shot. Now, with this being such a small number, why did the FDA issue the regulations?
Yeah, so let me start by saying there's clear evidence that shows that the risk of developing a blood clot after contracting COVID is exponentially higher than the risk of developing a blood clot after receiving the Johnson & Johnson vaccine. And this fact is really what makes the FDA's decision quite the conundrum. Simply put, why limit access to a vaccine that can prevent a disease that causes blood clots at an alarmingly high rate? Well, I'll tell you the primary reason, or in this case, reasons, are that there are two other very effective and from the perspective of causing blood clots, safer vaccines readily available right now, those being the Moderna and Pfizer vaccines. Ultimately, it came down to the relative safety of Johnson & Johnson compared to the two other vaccines. I agree with the FDA's decision, and hopefully this is actually going to boost the public's confidence in the FDA's ability to be decisive when evidence supports action.
And the FDA could clear COVID-19 vaccine shots for kids 5 and under next month, but a new study found only 18% of parents said they would vaccinate their young children as soon as the vaccine is available. So what should parents consider before making that decision?
Yeah, keep in mind that that survey also showed that only 27% definitely said no, they wouldn't get their children vaccinated. And that's actually a pretty similar percentage to prior surveys for children 5 to 17. Many want to wait and see the evidence. Others may feel that with milder COVID variants that have recently been out there, the risk versus benefit ratio doesn't favor the benefit. Now, you think about risk. What is risk? That's about the safety profile, the type of side effects, the frequency of side effects, and the severity when they do happen. Benefit is considerations like how effective is the vaccine at preventing infection, rates of severe illness, hospitalization, and death. Well, in the data that we've got thus far, the most common side effects with this vaccine for children under 5 were pain at the injection site and fever. And that occurred just as often as it does with other currently approved pediatric vaccines. There were no cases of heart muscle inflammation, aka myocarditis. There were no cases of multisystem inflammatory syndrome, and there were no deaths reported. And the results of the study actually showed that 51% of children who were less than 2 and 37% of children who were 2 to 5 avoided symptomatic disease with no cases of hospitalization reported. And so what this really comes down to is the ability of this vaccine in this age group to prevent infection, hospitalization, and death. Thereby, we're going to limit the spread to others who may be at higher risk with very minimal side effect profile. And so for parents out there, I completely understand wanting to wait and see, and that's fine. But keep in mind that when you do feel comfortable after discussions with your child's healthcare provider and others that may help in influencing your decision, it is safe and it is effective, and there will be more data that comes out. And keep in mind that if the FDA feels like this is unsafe or the risk is too high, they will pull the vaccine.
And I know we do know right now the World Health Organization says the number of newly reported COVID cases is falling globally, but they're actually up in North America, South America, and Africa. So is the global community getting COVID under control, or should we expect to always see, this type of up and down pattern in the future?
Yeah, so I think the global decline is a combination of things. Specifically, you've got higher rates of immunity, whether that came from vaccination, infection, or a combination of both, as well as the fact that there's much less testing than we were doing previously, combined with underreporting because people have at-home tests and they're not necessarily reporting this to the health departments. In the Americas and Africa, I really think that the rise was due to that rapidity with which we were exposed to Omicron and all its variants, and the relative contagiousness of it. I mean, keep in mind, Omicron is more contagious, more transmissible, but it causes less severe illness. I anticipate that our current U.S. hotspots, the areas which we are seeing this rise, are going to level out soon. And based on prior seasonal trends, if Florida does in fact see a significant uptick in cases, it won't be until this summer. That's just what we've seen historically. I really think that this is becoming a seasonal issue for us here locally and around the country.
And I know there have been 1 million COVID-related deaths in the U.S., and WHO released an estimate that nearly 15 million have died from COVID worldwide. Did you ever imagine that we would get to this number of deaths?
Yeah, that World Health Organization figure is just staggering. And there's two ways to look at this, and I think that a lot of us are really suffering with fatigue from hearing of all the catastrophe caused by COVID. You think about that. That's 1 in 300 Americans. That's frightening. On top of that, we really don't know what the long-term effects of COVID are going to be. For example, how many chronic lung, heart, brain, and other organ system conditions are going to come out from this. And ultimately, that's what's going to lead to the cost of more lives. And the toll of this isn't really just measured in deaths or total infections, but you've got to think about things like, what's been well publicized, what the effect on the economy, but also think about, what's happened with our life expectancy. As a human race, our life expectancy has been estimated to be shortened by COVID. You think more on a day-to-day basis. There's broad spread erosion of our mental health, and that really isn't being talked about. You think about the healthcare system. At times during the pandemic, you've heard stories about how it's crippled our healthcare system, and in its wake, at a minimum, we've been left with a 20% reduction in the healthcare workforce due to burnout. Now, think about how many deaths are going to ultimately result from the loss of timely access to healthcare. This cost has really been profound. I'm hoping that the lessons that we've learned from this pandemic really help all of us, whether you're in the scientific community or not, be better equipped should we face future outbreaks or pandemics.
Absolutely. Well, thank you so much, Dr. Patel. It was a pleasure having you on this morning.
Thanks for having me.